Hello, everybody. It's Patrick. It's after work, and happy Nurses Week to those of you in the audience that are nursing inclined. I guess there's a special week for nursing, and this is the week. Today is May 8th, and it's about 5:30. Working a little bit later today, but I started off later, so that works out okay. Had our interdisciplinary team this morning. I greatly enjoy our new medical director. Everybody's a lot of fun. And so because it's nursing week, they gave us snacks. I got a whole bunch of snacks. They gave us an attractive bag to put the snacks in. That's actually, looks like a very nice, reusable, multi-purpose, waterproof kind of drawstring sack of some kind. Which looks like a pretty useful piece of gear. But I have just so many bags. This will be one more bag. Bags are a very easy thing to give away. And so I have lots and lots of bags from employers, from clinicals at school. The public health nurse gave me a bag that was like branded with her public health district. And I just have so many bags. I will never run out. So I really appreciate the snacks. I think that was a really good idea. I've been having a hard time managing my nutrition during the workday. I think my usual pattern lately has been to have my first, coffee in the morning, then a multivitamin. No. Coffee first, and then a breakfast sandwich around noontime, and then a multivitamin around then, and then some fast food or diner food at around 9 o'clock in the evening. That's been my daily schedule. Not the greatest. So a little bit of fruit and nuts in the middle of the day. It's probably a good idea. So thanks for the fruit and nuts. Well, anyway, I think I've mentioned on a couple of other episodes that my weeks or months are sometimes themed with something that just comes up more frequently than usual. Like, I had a week, maybe a month or two ago, where it was just Foley catheter week. Everybody either had a Foley catheter or needed a Foley catheter, their Foley catheter was leaking or malfunctioning, or it was just the week of Foley catheters that week. And then, like another week, it was bowel movements. Everybody was getting constipated, or they had diarrhea, or they needed an enema, or they needed their laxatives adjusted, or, it was just bowel week that week. So this week seems to me, in my caseload, which I think right now is 14 people or so, the theme seems to be decision-making. Decision-making is the theme of the week. And, decision-making is something that's really central to what we're doing in nursing case management, because, we can't really be said to be taking good care of somebody if we're not involving them in the decision-making process of what happens to them, if they're able to participate in that process. Of course, for people who aren't well enough to make decisions, the burden falls to their family. But decision-making is still an issue because somebody has to make the decision. I can't make all the decisions. I can provide info and offer choices, but the decision has to come from them. And, one kind of decision that comes up a lot, particularly in hospice home care, the kind of nursing that I'm in, is the decision whether or not to be hospitalized. Sometimes this is a decision that the patient themselves is faced with, but a lot of the time it's a decision that family members are faced with. And you would think, if somebody put their wishes down in writing, saying very clearly that they don't want to go to the hospital, that would make that decision a lot simpler. They've already put down in writing, no, don't send me to the hospital. But it's more complicated than that, because it depends on why it is that they want to go to the hospital. And, in hospice home care, when somebody's on their hospice benefit, of course, everybody has the right to go to the hospital, if that's what they want to do. And we would suggest that somebody go to the hospital if their suffering wasn't under control. In fact, we would insist on it. If somebody's taking medicine to keep them comfortable, and that medicine is not working, and we can't give them more or give them something else, it's really not fair to them to just make them sit and suffer. You got to send them out. But, then there's going to the hospital for changes in health that we expect to see at the end of life, and that's sort of a different thing. And there may be some cases where it's appropriate to do that, and some cases where it's not. But the decision is sometimes not a very easy one. And I'm very often asked, I was asked more often in the nursing home this question, but it is something I get a lot as a nurse. What would you do if it was your own parents? And depending on who you ask that to, that may not be a good question to ask. But it is something that I've thought about. And, the question, in the context of, if it was your parent, would you send them to the hospital? And my answer, the first time I was asked this question, the way that I answered is the same way I always answer now, having been asked the question over and over again. And the way that I answer is, not if they said no, not if they didn't want to go. I'm not going to send them against their will. And that sounds pretty straightforward and pretty uncomplicated. But family processes are often more complicated than I think that they need to be, or more complicated than they would have been if everybody had communicated clearly earlier on, nurses become the arbiters of those decisions, or the arbiters of those decision-making processes, and very often people faced with these decisions are looking to nurses for their approval or disapproval as they're in the process of, testing out ideas, verbalizing things, and making their decision. So it's very important to be as affectually neutral as possible when these kinds of things are going on, and it requires a lot of discipline to do that, because of course we all have our own ideas of what we think is right, or what we think is optimal or favorable, or we all have an idea of what kind of outcomes we would like to see. But in the end, that may not be what actually happens. And I think, I've noticed that myself and a couple of other case managers that I work with have been very frustrated lately by cases where our advice isn't followed, or, people do things that we had warned them not to do because of some consequences, and they do them anyway. And can't really be more specific than that, unfortunately. But that can be very frustrating, for nurses, because we put a lot of ourselves in the outcome, we invest a lot of ourselves in our practice of nursing. So, I think the trick is not to be as focused on the outcome as much as the practice, making sure that everything appropriate had been done and it had been documented, and if people decide to make bad choices, then we can't let that affect our own professional self-worth, as nurses. And that's something that I understood intellectually going into it, but it's a lot different when you're running around and spending a lot of time thinking about your cases, and you just invest a lot of yourself in the cases and how people are doing. And most of the time, that's an okay thing, because by and large, most of the time, people are well adjusted and they're well educated and they're receptive to help and all of those good things. I would say that's the norm. But just by virtue of what kind of nursing that we're doing, we also deal with people that have very complex medical conditions and interrupted family processes, and maybe the police are getting called, or there's all sorts of interesting types of learning deficits that people will go to great lengths to hide from caregivers. And so case management has been a pretty educational experience for me so far, and continues to be so. A couple of my older coworkers have said things to me like, well, I hope you don't get stuck in this kind of nursing your whole career. But they were talking about hospice, but I sort of now that I'm almost done with my bachelor's degree, I tend to think of it more as nursing case management in general, because essentially you're looking at the same thing as the VNA. We just happen to specialize in terminally ill patients, but the care needs are the same. The principles are the same. The way that you manage pain is the same. Home safety is the same. All this stuff is the same. So I sort of think of it in more general terms as case management nursing in general. Hey, there goes a buddy of mine, my friend Teo. He's going to go to nursing school too. He'll be a good nurse. He's a Canadian. He's always running around and being fit. Good for him. What was I talking about? Oh yeah. So people would say things to me like, well, I hope you don't get stuck in this kind of nursing, but I could definitely see it being, complex enough and having enough room for growth and enough novelty to, warrant devoting an entire career to it. Absolutely. There's a lot of changes going on in how home health services are paid for, and in the nature of nursing practice at home. What the best practices are, things like that. But I'm thinking once I get my master's degree, it would be a shame to spend all that money getting a master's degree and then not making any more money. So I will have to be looking for something new to do. And public health is sounding more and more appealing now that I finished that last class on public health nursing. It sounds like I don't know. I talked about what I like about public health nursing in a previous episode, so I won't go over all of that again. But the more I think about it, the more I think I could give that a couple of years and see what it's like. I'd like to try not to spend more than 5 years doing any particular kind of nursing. I'd like to move it around a little bit more. I think having a master's degree will help me be more flexible in that way. Now that I've gotten a chance to talk to some of the APRNs in the area, they've assured me that no, don't worry, nobody will say that you're overqualified. There's a shortage, they want the most qualified people they can get. So that's it. I'm back home. My work day is done, and I think I've got stuff to do. I don't know, pay bills or something. Hooray! But I think it's next week is my birthday week, maybe? Maybe. You may not hear from me for a while, because I'm taking a whole week off for my birthday. Well, it was good to talk to you. Hope you're having a good day. I'll see you next time.